The stresses on GPs and surgeries are immense during this coronavirus crisis. Some of the workforce are self-isolating, the rest are hard-pressed to keep the service going. Moreover, we are trying to reduce the number of face-to-face contacts to the absolute minimum. This includes some of the regular appointments for routine care. However, this should never come at the price of causing harm to patients. I'm seeing a lot of posts, a lot of people worried, desperate even, that their vitamin B12 injections have been postponed due to the coronavirus crisis. This makes them feel very unwell and extremely worried that they will sustain irreversible neurological damage. Interrupting or postponing treatment with vitamin B12 causes harm both physically and psychologically. Also, at this time, we need to give people the best possible chance of fighting COVID-19 if they were to get infected. This includes providing adequate vitamin B12 for their immune system to function optimally. The immune reaction to disease depends on fast replication of cells, which itself depends on adequate availability of vitamin B12 and folate. So what can GP surgeries do when there simply is not the time nor the staff to deal with routine injections? At this time of crisis, we are all having to be creative and to take a little more calculated risk than we normally feel comfortable with. For managing pernicious anemia or a vitamin B12 deficiency at this time, there are several options. Have your general practitioner write a prescription for vitamin B12 and for syringes and self-inject at home. General practitioners can ask the patient if there is a nurse among their family or friends who might give them the injections. Then write a prescription for vitamin B12, also supply them with the needles and syringes that they need. Ask the patient if they are happy to self-inject. There is no reason that vitamin B12 should work any differently when diffusing into the blood from the subcutaneous fat or from muscle. Patients will need to be taught how to self-inject. As for any of the other self-administered medications, such as insulin and others, of course this needs to be done in a safe way. They can also prescribe 1,000 micrograms of cobalamin tablets to take tablets 1 to 2 times daily. In patients with pernicious anemia, oral vitamin B12 cannot get absorbed through the intrinsic factor route because they do not have any. However, there's a second, much more limited route of absorption, passively through the intestinal mucosa. About 1% of any oral dose is absorbed this way. Therefore, of 1,000 micrograms dose, 10 micrograms gets absorbed, which is enough for the daily requirement. However, some patients report that this does not work well for them, and they experience a relapse in their symptoms. Particularly in patients with any bowel condition, Crohn's, celiac disease, small bowel overgrowth, amongst others, this may not work. Therefore, careful monitoring of symptoms is essential when changing patients from parenteral to oral vitamin B12. If symptoms return on oral medication, either the dose needs to be increased to 2,000 micrograms daily, or they need to be restarted on parenteral vitamin B12. Please be aware that oral medication is not suitable for initial loading after diagnosis. If patients are happy to buy their own sublingual tablets or sprays, this may be encouraged as well. The dose should be at least 1,000 micrograms per day. Stopping vitamin B12 treatment is dangerous for patients. For people with vitamin B12 deficiency, whether due to pernicious anemia or to any other cause, doing without regular treatment is simply not an option. Many struggle with 2 to 3 month intervals as it is. Making the interval longer puts them at serious risk of irreversible neurological damage. The whole of the nervous system absolutely depends on sufficient supply of vitamin B12. Severe loss of quality of life due to symptoms such as debilitating fatigue, insomnia, vitamin B12 is required for synthesis of melatonin, mental illness, and other neurological symptoms, inability to work at a time when many jobs are already on the line. It seems reasonable to assume that patients who feel unwell due to lack of vitamin B12 will be less able to fight the coronavirus should they get infected. For many patients, their injections don't last long enough. Some clinicians assume, incorrectly, that 1,000 micrograms of vitamin B12 should last patients at least 200 days, calculating from a 5 microgram daily requirement for the vitamin. Research indicates that the daily requirement may be closer to 10 micrograms daily. Unfortunately, vitamin B12 is not stored in the body. After an injection, as much vitamin B12 as possible is captured by the transport protein in the blood, cyanocobalamin 2, and delivered to the cells. All non-protein vitamin B12 is quickly excreted by the kidneys. One product leaflet for vitamin B12 states that 50 to 98% of injected vitamin B12 is excreted with the urine. This explains why patients may experience relapse after a certain amount of time after their injections. When asked, patients report about 80% of them say that their symptoms return weeks or months before the next injection is due. It makes them feel unwell and puts them at risk of neurological damage. It's like filling the car's fuel tank. Whatever excess is poured in simply runs over. And if you're only allowed to fill once in 3 months, the car simply won't run for 1 or 2 months. That is how many patients feel on injections once every 3 months. For 1 or 2 out of those 3 months, they're too exhausted to function. If anything, we should be shortening the interval between injections, not making it longer. There is no risk with shorter intervals. Any excess vitamin B12 is eliminated by the kidneys. The symptoms of a vitamin B12 deficiency. Methylation is needed for the synthesis of myelin, neurotransmitters including the adrenal and melatonin, epigenetics, protein repair, cell multiplication. While vitamin B12 is a cofactor, methylfolate is the methyl donor in the previously mentioned process. Therefore, both vitamin B12 and folate, if they are deficient, can result in anemia. Fatty acid metabolism in the mitochondria is also another symptom of vitamin B12 deficiency. This likely contributes to the fatigue most patients experience. Further symptoms of the vitamin B12 deficiency or pernicious anemia is the mind, brain fog, as many put it, poor memory, poor concentration, word-finding difficulties, dementia, insomnia, mood, such as anxiety or depression, sensory, pins and needles or numbness, motor, muscle weakness, ataxia, reduced reflexes. And then there are problems due to the lack of cell division in fast-dividing tissues, anemia, mouth ulcers, malabsorption, diarrhea, frequent infections, and that debilitating fatigue that many talk about. If you'd like to know more, please visit my website at www.b12bu.com.